I'm pleased to to update you on those results. So this was the phase 2 registration study of cemiplimab in advanced cutaneous squamous cell carcinoma, so patients with either metastatic disease or locally advanced disease that wasn't amenable to surgery or radiotherapy. And so the key, this is a study that there have been multiple cohorts, and this is a pooled analysis of the first 3 groups that have been treated with much longer follow-up. So we have 3-year follow-up on a number of patients, and the median follow-up is about 16 months now. Really the key findings relate to the fact that the response rates across the 3 groups is maintained. It averages at 46%, so that's been fairly consistent. And one of the new findings is that as you look at the cohorts over time, the complete response rate appears to increase. So these patients were generally treated in groups 1 and 2 for 2 years, and groups 3 for 1 to 2 years. But with longer follow-up, complete response rates increase. So for group 1, which has the longest follow-up, the complete response rate when the first analysis and what was in the publication of the original study in New England was only 7%. It's now up to 20%. We're seeing that across the board in these groups, where many patients are deemed to have partial responses, but some of them on imaging convert to complete responses. The other key finding, and really a very important finding, is the durability of these responses. So with this longer follow-up, we can see that the majority of patients that have a response maintain the response. So at 12 months, 88% of the responders have an ongoing response, and at 2 years, 70% of responses are sustained. So it's only 30% of the actual responders have experienced relapse at 2 years. So it gives, you can see on our results, the overall survival at 2 years of all patients is 73%. So that's pretty remarkable for a group of patients that really had very little in the way of effective treatment previously, and a median overall survival expected at best of around 15 months previously.